This week on Healthy Living, for International Women's Day, we celebrate women's key roles and impact in global health. African nurses share their challenges and triumphs as pillars of healthcare. And Amie Batson, president of WomenLift Health, sheds a light on women's leadership in the medical sector. Plus, from Nigeria to Somaliland, the story of remarkable women revolutionizing medicine across Africa. These stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. March 8th is International Women's Day, a day to celebrate women's various accomplishments over the years and reflect on some remaining challenges. The World Health Organization says women account for 67% of the global health and social workforce. They are making a significant impact in boosting medical research, shaping healthcare legislation, and transforming patient care. We start in Nigeria, where for many years, the people of Gadani Jato community in the northwestern Kaduna state have had to travel to neighboring cities to receive medical care due to the lack of functional hospital in their area. Patients requiring emergency medical care often succumbed to death before reaching the hospitals due to poor transportation systems. One volunteer is now making a difference.
It's a Wednesday afternoon, and as usual, Hafsat Muhammad is finishing her daily work, domestic chores, before setting out to the only health center in the community where patients are waiting. Hafsat is not a qualified health worker. However, because of the lack of medical personnel in the area and the challenges people seeking medical attention face, she decided to step in.
I am volunteering services in the clinic. My level of education is not advanced. I stopped when I obtained a certificate. It's like a preliminary education in the area of health.
But Hafsat does not view her educational background as an obstacle to helping the community. For years, members of the community have been traveling long distances to neighboring cities to get medical attention for their sick. And because of poor roads, patients were being transported on motorcycles, causing miscarriages and other complications for some pregnant women.
I have come for the antenatal, and she helps us a lot. If a sick person is brought to the hospital, they will go and call her at home, and she comes out to help the person.
Hafsat receives calls at any time of the day whenever there is a patient in the clinic. Despite her voluntary spirit, she faces challenges.
We're suffering from lack of electricity and water in this hospital. When we receive a patient or pregnant woman in labor, we use the light from our cell phones to help them. And when our phone batteries run down, we continue to do it in darkness.
The traditional ruler of the village described Hafsat as a blessing to the community.
The way you see her in the hospital, that is how she is always available, even at midnight. She is always ready to help.
The Gadini Jatal is one of the many areas suffering from the lack of healthcare facilities, but many of them are lucky to have volunteers like Hafsat Muhammad to fill the vacuum. Deirdre Murray McIntosh for Fatima Celine Ladan, who reports from VOA Kaduna.
Nurses are the backbone of health services. They are in every community and often the first healthcare providers patients will see before consulting with a doctor. And in some communities, they are the only medical providers. We asked some nurses to share the challenges and rewards of their profession.
I really enjoyed the job of nursing since I was a little kid. First and foremost, I wanted to know how the human body. The first challenge is that the nurse is doing multiple jobs at the same time, and this depends on what environment she is in. There is an environment where the nurse is used as a sweeper, messenger, collects and transmits patient tests in the laboratory. The second challenge is that there are not enough tools as needed. We have a shortage of labor supplies and a shortage of workers at the same time. This is a major challenge that brings us to conflict with patients, where they feel that the nurse does not care about patient at all. This is due to the shortage of workers.
Women doctors face challenges regarding opportunities to get promoted. We don't have many women in top leadership positions in hospitals. One other issue is that women doctors face challenges in finding resources to pursue training in specialized medical fields. My hope on behalf of women doctors is that we receive support from the government and partners to afford us training in these specialized fields, because that's a serious problem, as I mentioned. I hope that the law would take into consideration the issue of maternity leave to enable a woman's right to her time off as a new mother, so she can breastfeed as recommended by experts without losing some of her employment benefits.
Women make up the majority of the workforce in the health sector, yet they face significant roadblocks as they seek leadership roles. For more insight, we spoke with Amie Batson, the president of WomenLift Health, an organization that works to improve women's leadership in global health. Here is what she had to say.
There's a lot of barriers to women advancing to leadership positions, and some of those barriers are very explicit and some are more sort of implicit, and they vary from country to country. And so you have, in some countries, it's just outright harassment. There's sort of a, you don't belong here kind of comment to senior women, or you talk too much, you talk too little, you need to be respectful to your male elders. And we've heard often reports from women leaders of how challenging it can be to suddenly be the manager or supervisor of men, especially men that might be even older than they are, and how these men have difficulty suddenly accepting that this person is making the decisions and is their boss. And when you only have men at the table, you're leaving out 50% of the population. Well, so we work on three key pillars. One is leadership, individual leadership development. The other is institutional influence. And the third is society, because you can't just invest in the woman. You also have to be influencing where she works and lives. At the institutional level, we're looking at how can we be working with senior leaders to be having the will, having the awareness and the commitment to take action that addresses some of those issues I was talking about, like the double standards that are applied to men and women. And at the societal level, we work with influencers and champions about like where we can be bringing a platform for them to be using their very respected and heard voices on issues about, for example, why women's leadership is important for the country. It's been really exciting to see the results of our work. Now, we're still relatively young, we're 4 years, but already what we're seeing is the changes for these women, that they're, both on quantitative, like we do evaluations, as well as qualitatively. We're hearing how these women are now having a higher degree of confidence, of recognition of, oh yeah, I am a leader, even though I've been told all these years, I'm actually like, an important and powerful leader. How they're working in healthcare and they're recognizing challenges that have been there that nobody's been paying attention to. So, for example, we have each of our women also has a leadership project, right? That's something where it's about impact at the health and gender, intersection of health and gender. And so the ripple effect of what these women are doing in the health sector, taking on some of these challenges in their institutions, in their communities, is really inspiring to see.
Experts say key ways to improving women's health across Africa is by empowering women. Here are some remarkable women who are revolutionizing medicine in Africa and inspiring the next generation. Edna Adan Ismail is a nurse midwife, activist, and former Somaliland's Minister of Family Welfare and Social Development. She is the director and founder of the Edna Annen Maternity Hospital in Hargeisa and an activist and pioneer in the struggle for the abolition of female genital mutilation. Ismail underwent FGM at the age of 8 and later trained as a nurse and midwife in the United Kingdom to help prevent other women from undergoing the same trauma she did. She is said to be Somaliland's first qualified nurse. Dr. Ola Brown is a British-Nigerian medical doctor, healthcare entrepreneur, and founder of the Flying Doctors Healthcare Investment Group and a director of Green Tree Investment Company. Brown started the Flying Doctors to contribute in improving medical services in Nigeria after experiencing the loss of her sister under difficult circumstances. Among other things, Flying Doctors Healthcare Group is active in air ambulance services, hospital and clinic construction, and pharmaceutical retail. Professor Karesha Abdul Karim is an infectious diseases epidemiologist whose main research interests include factors influencing acquisition of HIV infection in adolescent girls. She is an associate scientific director of CAPRISA and was the principal investigator of the landmark CAPRISA 004 tenofovir gel trial, which provided proof of concept for microbicides. She is a professor in several institutions, including Columbia University in the USA and University of KwaZulu-Natal in South Africa. She is currently Vice President, Southern African Region of the African Academy of Sciences. In Bordeaux, France, a surgeon cares for the patients she operates on by the unique sound of her voice that some patients find soothing.
The operating room with its pale lights contrasts with the warm and captivating voice of Aisha Ndoye, covering Whitney Houston. The French surgeon who soothes the patients she operates on leads a double life as a doctor and singer.
The first time I sang, I was still an intern. I was still a student, and I really sang in a moment of desperation when we couldn't get a patient to go to sleep because she was totally agitated and wouldn't let herself be perfused. And so I was washing my hands and I thought, maybe I'd try something. The last option we had was for me to sing. Well, I sang to the patient, which kind of captured her attention, so I was able to infuse her at the same time and put her to sleep. And since then, I've made it an integral part of my work.
At 34, Ndoye, a gynecological surgeon specializing in oncology, released her first album with 2 other colleagues. The trio, Les Soignantes, reached the semi-final of France Has Incredible Talent.
There's a purpose behind it. It's not just singing. It's not a concert. For me, it's therapeutic, and they understand that. And they're now all very, very happy to see me sing.
Lucie Deneau, an operating theater nurse, says a person who sleeps peacefully wakes up more gently, and the body requires less anesthesia.
It's relaxing, but it's not only relaxing for the patients. It's also relaxing for the general atmosphere in operating theater. It's not just the music you can hear, it's really the voice of a surgeon with her patients. And it's very powerful in human terms. It even moves us to tears at times.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.